Eggleston. I'm the Lee County Environmental Health and Communicable Disease Supervisor. And in 2017, Lee County was contacted by Adams and Juneau County to ask if we would provide environmental health services for Adams and Juneau as well. So I do work a 3-county area, and so I just want you to know that locally we work for everybody in this local area. So I want to give you a local idea of what's happening in one of the things that's happening in our communities right now and here. So it's kind of a little different picture than what the other presenters have been doing. To give you some background, in early 2018, I was contacted by a county board supervisor who asked, and another community member who asked if I would be willing to go along with somebody from UWST, the water center there, to talk to a group of community members in the Armenia and Port Evans area about their water quality concerns. Nitrates were getting higher and higher in that area, and they were very, very concerned. So on a very snowy, cold January night, we met at a home. Several families were there to talk about what their experiences have been with their nitrate issues. One of the things that was brought up is that a family in this community, and it's a close-knit, small community, had a baby that died of a neural tube defect just after birth. This family, the woman that was pregnant, the water was at 42 parts per million or milligrams per liter nitrate. She didn't know that going into the pregnancy. Nitrates have been linked to neural tube defects. So anyway, this really shook up the community and made them very, very concerned about their health and the health of their children and their families. One of the problems that we saw right off the bat is that a lot of people have been doing testing for nitrate, but they have not been doing it routinely, and it had been done in different labs at different times. So what we wanted to do is do a survey of this area to figure out exactly what was going on, what was the extent of the contamination, and to do it all at one time so that we had data at a certain time of year, so we could actually look at what was going on with these folks. So following the meeting, I met with the Juneau County Health Officer, who then was Barb Weiss, and the Land and Water Conservationist, which at that point in time was Matt Kniske, to talk about what we were going to do. So we decided to move on to a groundwater survey of the area. So this is the area that we were talking about. It's the town of Armenia in Juneau County and the town of Port Evans in Wood County. So it kind of straddles the two counties. The arrows are the direction of groundwater flow, so this map is kind of messy, but that's the groundwater flow, and the elevations are there. So there is a groundwater divide where some of the water is going straight to the Wisconsin River, the Peat Well, and some is going off to the west to the Yellow River, and then eventually down into the Wisconsin River. This map shows you the areas, the type of land use in this area. So the yellow is all agricultural land. The Central Sands area is at the northern end of Juneau County. The yellow is ag, the green is forested land, and then the darker blue would be wetlands. So that's where some of the cranberry marshes are in this area. So looking at the depths of wells, this is sand country. All of this is very sandy in this area, so sand points are very common, so you're not going to be seeing super deep wells. On this map, anything in green, blue are deeper wells over 100 feet. There really aren't a lot of those. Most of them are well under 100 feet deep. This is probably a slide you've seen a million times before. This is the nitrate and nitrogen slide, and it kind of gives you the idea of where we start seeing human influence. With nitrates, 10 is considered unsafe. That's on federal and state standards. Less than 0.2 is natural, around 2 is transitional, but between 2 and 10 we're seeing human impact. So when we talk about unsafe water, we are talking about impacts that children can have, or impacts on infants. Blue baby syndrome is one of the things that we see in infants. But as far as, there's also impacts on pregnant women and women who may become pregnant. It's been linked to miscarriages and birth defects for that population. And then for all others, other children and adults, their high nitrates have been linked to certain cancers, thyroid disease, and diabetes. So, and those with existing heart or lung disease may be more susceptible to the harmful effects of nitrates. And in talking to some of the folks as we've been doing some of these water testing programs, they were very concerned about their pets as well and their animals. And so the toxicologists at DHS, I talked to them and some of the DNR folks and DAPCAT folks about animals, and they're just as susceptible, like dogs, cats, whatever, are just as susceptible to nitrate at about the same level. So, you know, we do need to be concerned about them as well. People consider them part of the family. When we decided to do this water survey, we went out in teams of two county employees and actually collected the water ourselves. We didn't want there to be any question as to where the water came from, and, you know, if this was accurate or whatever. So that was kind of the plan that we went through. On this map, you'll see that anything in red or black are unsafe water samples. So there were 104 that we did in this May 2018 testing program, and we found quite a few of the high levels of nitrate. The highest that we found in this one was like 55.3 milligrams per liter nitrate, and again, 10 is the standard. At about the same time, just before we already had set up our water testing program, then the EPA came in and they did some studies and some testing around the Central Sands Dairy in northern Juneau County. They drilled 41 boreholes surrounding the Central Sands Dairy. They went both up gradient and down gradient of the dairy. And they took samples at 2 depths into each one of these boreholes. So if you could, this one is 20 to 34 feet. So this was the shallower wells that they were looking at. And 41% of these exceeded the nitrate standard of 10 milligrams per liter. But if you'll see on this one at the shallower depths, more of them were in the 10 to 20 or 20 to 30 as range as far as the unsafe swim. At the deeper depths, 36 to 49 feet, you'll see that some of they had higher exceedances. It was 42% exceeded the nitrate standard of 10, but we had more in the 30s and 40s in their study. And all of the EPA studies, those can be found on the internet. The whole study is there, as well as some of the isotope testing that they did looking for sources of nitrate. At the same time, the EPA collected samples near the Central Sands Dairy from 5 different households. And these were the nitrate results that were at those households, quite high. They also tested for chloride, which is shows that there has been some fertilizer use in this area as well. So these households were also tested by DAPCAT for pesticide traces, and all of them did test for a number of different pesticides. None of them were over the standard, but again, some of the things that, some of the compounds that were found, there aren't even any standards present for those items, for those chemical compounds yet. So that's one of the things that now the DNR and DHS are working on, is coming up with some standards for some of these pesticides. In response to this contamination that was found in this Armenia and Port Edwards area, the Armenia Growers Coalition contacted the health department to say, we need to work on this and we need to figure out what we can do for the people in this area. The Armenia Growers Coalition are 3 different farms with fields in this agricultural corridor. So we came up with a memorandum of understanding. That memorandum of understanding was worked on by the EPA, the DNR, our county corporation councils, and health departments to figure out what are we going to do for these people, where can we go. So some of the components of the MOU was the Clean Drinking Water Plan, and with that plan, in this ag area, we wanted to do free water testing, followed by bottled water and point-of-use RO systems, or reverse osmosis systems, for all those that were over 10 milligrams per liter of nitrate. This MOU also included a groundwater hydrogeology, ag practices, and monitoring plan. So with the Clean Drinking Water Plan, this MOU, we did outreach to over 1,000 private residential well owners whose wells were not yet tested. In that notification, we let them know that there were concerns of high nitrates in their area. We provided health information on nitrates in drinking water, and then we also offered a free nitrate test to be analyzed at a DNR certified lab. And then as far as the hydrogeology study, a 2-year study would be done by the DNR with hiring researchers. The study is funded by the AGC and the DNR. And there were several goals of this hydrogeology study. One is to identify the 3D distribution of water with less than 10 milligrams per nitrate to supply well-paying owners. So we're looking for where can we find clean drinking water for these people. The other thing is to ID that same distribution of water supply for 25 years out. We want to know that if we give people a well recommendation, that they can count on that being safe for them for at least 25 years under present use. Part of this plan is also to come up with and recommend portable well casing depths in this area. So that's part of the reason why we're doing a lot of the water testing, to come up with more results so that we know where are the high nitrates, where are they not, and at what depths are we finding them. And then they also want to identify model scenarios that would help define land use changes that would be helpful to achieve groundwater quality goals. Another part of this memorandum of understanding was a 2-year program to evaluate ag impacts on groundwater in the study area, and that would be a farmer-led initiative. Farmers would be working with the DNR and the county conservationists to come up with some new practices or changes in practices to reduce the impact of nitrogen on groundwater. That initiative has not yet begun because they're waiting for water test results before they do that. So this is the second round of testing now, and we're trying to get reached. We now did the first one, and now we're going to, with this clean water, drinking water plan, we're trying to outreach to the rest of the county that in this agricultural corridor that was not yet tested. So there were a couple different ways that we did this. The AGC contracted with AECOM, a consulting firm who worked with Northern Lakes Lab, to actually go out and do on-site testing, sampling for people. And then there was also a second component where people, if they didn't want people on-site testing, that they could do their own homeowner sampling for that. The Wood County results, we had 21% were unsafe of the 229 Wood County samples. So you can kind of see the distribution of those unsafe. Those are the stars. The green dots are safe, the stars are the unsafe. So there's quite a few on top of each other, so they don't all show up real well. One of the things that we did to make the water testing programs easier for our residents was the Wood County Health Department put in a Wood County water laboratory so that we could provide the nitrate testing for Wood, Juneau, and Adams County, for these water testing programs, so that we'd have a local resource so that the health department can work with land conservation to get these things done. These are the Juneau County results. Again, we had 112 that AECOM sampled, and 41% of those were unsafe. We also had 91 that did self-sampling. They took their own samples, brought them to the lab, and 18% of those were unsafe. So of this whole Juneau County area, 31% were unsafe of the 203 that were just recently done in Juneau County. So the progress of this MOU with the Armenia Growers Coalition to date, 7 reverse osmosis systems were installed, and those were for anybody that were per liter of nitrate. 14 of these systems are scheduled. One of the problems with these RO systems is that when we have unsafes, they're not like 10, 11, 12. Many of them are well over 20, 20s, 30s, 40s. So the reverse osmosis systems, the point of use under the same systems, can't always handle that high of a load. So they're waiting to get an approval on an alternate system that will allow that point of use under the sink for those really high nitrate results. So and with this program, bottled water is distributed upon request to those exceeding the standard until a reverse osmosis system can be installed. The benefit of the RO system is that it eliminates both nitrate and pesticides, so it kind of takes care of all the needs they have. So 104 homes were tested in May of 18, 432 in just this past couple months. So we've got about 464 more homes in this corridor to be tested. So we're going to be working on trying to get the rest of those tested. In the meantime, the DNR is working with the researchers to begin the funded groundwater study, and the farmer-led initiative still has not begun. So moving on from groundwater to surface water, I wanted to talk a little bit about this because when we're talking nitrates, nitrogen and phosphorus levels also impact our waters. Between groundwater, nitrate and phosphorus issues, and then also our warming of our climate and the warming of the water, it ends up in a kind of nasty state. So this is a picture on Castle Rock Lake. It was, I took this picture on a weekend. It was kind of fascinating because it looked like styrofoam, like 3-inch thick styrofoam. These were these mats that were kind of just floating around. But a penny just went right through, so I just had to do it. But anyway, alcotoxins can affect health depending upon the amount of the toxin and whether it's inhaled, ingested, or exposed on the skin. The toxins can also get into fish that are in this area, in the algae. And if people eat any organs of the fish, or if they're touching the fish that are full of the toxins, they can either get dermal exposure or they can get sick from eating the fish. So this blue-green algae does pose a risk to recreational users. There's strong odors that are associated with the blue-green algae. And it also places a financial burden on the businesses, because many of the businesses in this area rely on boaters and other lake patrons using the facilities in order to make their money during the summer months. So the health effects of blue-green algae can occur in minutes to days after exposure, so it really varies as far as when people would be exposed and when they're going to be getting sick or having an effect. This picture is also from Castle Rock. And the color's nice. Anyway, respiratory, we got sore throat, congestion, wheezing, coughing, difficulty breathing. Skin issues can be blisters, hives, rash, redness, itchy skin. Ingestion, it can cause earache, agitation, headache, abdominal pain, vomiting, and diarrhea. But in severe cases, it can cause liver failure, respiratory arrest, and very, very rarely death can occur. So this kind of exposure is, it's another thing to consider when we're talking about groundwater and surface water and what our concerns are in this area. So that's pretty much what I have for you. So one of the things that I would ask is that the main thing that rather than treating water is just a Band-Aid. It really does not help. What we need to we need to help these folks find safe drinking water. Well, we were doing this water sampling program, and I heard from so many citizens, because when there's an unsafe, I'm the lab director, so I call the people that have unsafes and let them know what their number is, and I got a lot of very, very surprised people. They're like, we just bought this property 2 years ago, and 2 years ago it was at 5, and now you're telling me now it's at 17? I'm like, yes. There was one woman that was very upset. They had no D-text in 2015 when they got their house. She homeschools. There's 3 small children, and they were at 18 milligrams per liter nitrate, and had no idea because they just assumed it was still fine. But what we're seeing is the nitrate levels are really raising quite quickly, and the cost. A lot of these people don't have a lot of money. They are not wealthy, and putting an RO system in, for one thing, they have to upkeep that RO system. They need filters. Filters need to be changed. That system is not going to last forever. That system needs to be replaced. So in the long run, and this is what the DNR's recommendation is too, is they don't want people to rely on treatment systems. They really do want to be able to find safe water supply with their drinking water wells. So studies like this can really help us to determine where that can be, and then also working with the farmers to try and come up with different practices that we can do to try and reduce that nitrogen load. And what was alluded to earlier as far as the nutrient management plans, the concern with that is that they just don't, we need to have them, a component of the nutrient management plans be groundwater protection, not just crop efficiency. And maybe we need to start thinking outside the box, because right now we keep talking about growing the same crops in the same way, adding nitrogen to sandy soils. The same thing's going to happen unless we do something different. We need to change out our practices to do something different. Maybe we need to consider subsidizing farmers to grow different crops on these sandy soils and help them to make it profitable for them to do that in order to make a switch to something new, because again, this isn't working to keep throwing nitrogen on sandy soil and expect that the groundwater is going to be okay. In response to this, in response to the nitrate contamination here, we have started a group of 7 counties, all in the Central Sands area. We're starting to meet to talk about how can we address this, the nitrogen issue in sandy soils. So it's a group of both land conservation individuals, health department individuals, and county board supervisors that are also meeting. So we're just kind of in our beginning phases of that. We're looking at doing a research study to figure out, we're trying to develop our research questions right now, like what do we want to know? Basically, we know what we're trying to figure out is how do we have safe drinking water for everybody and safe water wells for everybody in the Central Sands area, but it's how do we go about that? What changes do we need to make? So those are some of the questions that we're working on right now, and I can turn it over to